So intelligence have been defined in different ways. If you will go to the definitions of intelligence, initially it was defined as some unitary ability. Some defined it like the ability to do reasoning. Some defined it ability to learn. Some defined it as ability to memorize. So there were many conceptual definitions of intelligence, and they were considering intelligence from that perspective or that point of view. So all the tests that were developed followed one or the other conceptual or definitional perspective. But you all know one popular name is Spearman. He took several tests of intelligence that were available at his time, and he administered all the tests on a same group of participants and analyzed the correlation, and he noted that all the subtests are having a strong correlation with each other, and then he reasoned and he invented what is called factor analysis. He reasoned that all the intelligence tests share something in common, and that common underlying factor he referred to as general mental ability. And you can consider general mental ability as a fund of psychic energy or fund of mental energy that can be utilized to do all sorts of intellectual activities. For example, you can consider it like electricity. Uh, Electricity is flowing in the wires. If it is connected to a fan, then it gives us air, AC, it cools us. If it is connected to a heater, it provides heating. If it is connected to a fridge, so the same electrical energy, when channeled in different ways, can do different things. Spearman conceptualized general mental ability something like this: that it is like a fluid. As fluid can take any form. If you fill it in a glass, it will take the shape of the glass. If you will fill it in a jar, it will take the shape of the jar. So that is the general mental ability. But he also recognized that these tests also measure some specific abilities, and therefore he gave two-factor theory of intelligence. Similarly, the debate goes on and many definitions have been proposed. One very common and widely used definition is given by Wessler, and I am repeating that because I have to teach Wessler adult intelligence scale. Wessler defined intelligence as a global capacity to think rationally, act purposefully, and deal effectively with one's environment. So, for him, intelligence is a global capacity. Using that, we are thinking rationally, we are acting with some purpose, we are not acting purposelessly, and with that ability that is called intelligence, we can deal effectively with the environment. So today we all know that most of us are having average intelligence, and because of that we are able to adapt with different environmental demands. For example, rather than teaching and learning in face-to-face environment, because of this intellectual capacity we have learned to interact with each other and learn with each other through this online mode. So, this was the definition of Wessler, and there are many other definitions. If you want to learn more, I will recommend one article uh, published in American Psychologist. That is one very good journal, and the title is Intelligence Known and Unknown. And this is basically a report of the American Committee of Psychologists who were given the task to identify what actually intelligence is, because there were too many disagreements in defining intelligence, and that debate is still continuing. But For us, we can think it as a capacity for thinking rationally, acting purposefully, and dealing effectively. So, you all have, I am saying this for non-psychology students, that you all, when you appeared in this examination, you might have seen the syllabus that there will be some questions on general mental ability. Then basically the reasoning questions, the quantitative reasoning, numerical reasoning, uh, other visual spatial reasoning, you might have seen all these questions and you have completed those questions and therefore you are here. So you know what is intelligence test. You have seen those who have not studied psychology. So intelligence test is used for different purpose. Those who have studied psychology, and here I would like that some of you please interact. Those who have studied psychology, they know that what is intelligence and what are the intelligence tests. You might have studied intelligence test in such papers like psychological testing, psychological assessment at undergraduate level. If you have studied organizational psychology, then you might have come across the use of intelligence test in recruitment and placement. So intelligence test is already there. My question is that why, as a clinical psychologist, when our purpose is to understand the nature of psychopathology, nature of various psychiatric disorder, mental disorders, then we should use different tests. Why and how intelligence test will be helpful for providing diagnostic information. I will teach, but I would like to hear from you. Have you got the question? You might have studied intelligence test, and we will study intelligence test as a clinical psychology student, but our approach will be little different. For example, when you studied intelligence test in psychometrics or psychological assessment or in psychological testing, then you basically learned the structure of the test, what are the test item, what the test measures, the reliability and validity of the test, how the test was developed. If you have studied intelligence in some other context, say educational psychology, organizational psychology, then you might have studied how intelligence test can help to screen good students, how intelligence test can be used to select good employees. But when we will be studying intelligence, our focus will be how to use this intelligence test performance of a given client or respondent to arrive at clinically useful information. Any one of you want to say anything regarding my this? Yeah.
So, for diagnosis of neuropsychological disorders,
Yes. Very good. So, how you assume that intelligence is dependent on the brain function and structure. If there is any impairment in the structural or functional aspect of the brain, then intelligence will be lowered. So, with this assumption, you can use intelligence test. If intelligence test performance is poor, then it is likely that one may have uh, some brain dysfunction or brain damage. Just I am putting you on hold. So, coming back, intelligence test can be used for definitely for neuropsychological assessment. Basically, The major areas of clinical application of intelligence test includes the clinical psychologist, and clinical psychologists use it for different purpose. I will show it in the next screen. School psychologists, they also use intelligence test for their own purpose. Similarly, for example, uh, screening of students, screening of some disability, learning disability, particularly school psychologists may use intelligence test. Similarly, those who are providing guidance, particularly educational and vocational guidance or counseling, they can also use intelligence test for their purpose. Similarly, rehabilitation psychologists, if they are doing neurocognitive rehabilitation, cognitive rehabilitation, rehabilitation of mental ability, then the rehabilitation psychologists also use this uh, psychological test. And as mentioned by one student, neuropsychologists also use intelligence test as a neuropsychological tool assessing brain probable brain damage or dysfunction using the measures of intellectual ability or mental ability. I have summarized few clinical uses. It is not the exhaustive list. You can add more. And you can see three different colors because they are in three different sets. You see first the major use of intelligence test as a clinical psychologist is diagnosis of mental retardation. If you know the definition of mental retardation or diagnostic criteria of mental retardation, the first one is that the client should have below average IQ, and we cannot do this by mere interview, observation, or other things. We will need some standardized measure of intelligence, and then we can meet the first criteria of diagnosing mental retardation. So this is one clinical use. Directly we use intelligence test, and here intelligence test is the main tool for making diagnosis. Similarly, for neuropsychological assessment and for assessment of cognitive disorders, we use intelligence test. For example, DAT, dementia of Alzheimer type, intelligence test in the comprehensive assessment of DAT, intelligence test form one important part. We assess memory and other functions also, but for diagnosing dementia of Alzheimer type, but general mental ability test or intelligence tests are also part of that assessment. And similarly, for screening and diagnosis of learning disabilities, we use intelligence test because by definition, learning disabled individuals may have average or near to average mental ability or intelligence, but they are facing some problem in learning. Their school achievement is lower than other person. So for making diagnosis, we use some achievement test and intelligence test. So these are the blue shaded uses. They are the direct use of intelligence test where we use intelligence test for making diagnosis or diagnostic information. Similarly, evaluation of intellectual capacity for educational and vocational guidance because one who is having very high IQ score will be more suitable for one vocation compared to those who are having average or below average IQ. So, apart from other psychological tests, the educational and vocational counselor or guidance provider also assess intellectual capacity. Similarly, for determining special educational needs, like if one is having learning disability or mental retardation, as I mentioned, the school psychologist can use intelligence test for this purpose also.
Sir,
Yes.
so the slides are not changing.
Slide is not changing.
No, sir.
Oh, so your response time is so late. Uh, 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 but I can see, can you see clinical use slide?
Yes, sir. Now it's visible.
So I have not changed the slide. I am discussing only this.
Sir, actually, the first slide was visible up till now.
No, can you see the slide with heading clinical use?
Yes, sir. Just now. Right now. Just right now.
Okay. So there is some problem. I don't know how to handle with this. Uh, uh, but you immediately tell me when you feel that I am discussing something else and slide is not changed. Can you see this? Clinical use.
Yes, sir.
So for determination of special educational needs, similarly evaluation of intelligence and mental level of delinquents, the intelligence test can be used, and these are the clinical applications. Similarly, if some children are showing maladjusted, maladaptive behavior, then we can assess intelligence whether the uh, maladjustment problem is because of intellectual lack or loss, or it is because of some other psychological factors. And the third category of use is differential diagnosis of patients with various psychiatric disorders. So there are and there have been several researches which have tried to extract or derive diagnostic indicators solely based on intelligence test scores. So there are different profile scores that define different types of psychopathology. So as a diagnostic indicator, we can use intelligence test, and I will tell you. Similarly, for ruling out the problem is not due to poor intellectual functioning, because when you will go through different diagnostic criteria, this ruling out criteria may be found in several diagnostic categories. And therefore, for example, in learning disability, we have to prove that it is not because of poor intellectual functioning, it is not because of below average IQ. And diagnosis of cognitive impairment, as I said earlier, that is the intellectual disturbances, disorientation, and other intellectual deficit. And finally, for psychotherapeutic planning and decisions, we can use intelligence test, because all psychotherapies cannot be applied to below average or at the worst of average intelligence people. Some psychotherapy requires a lot of intellectual work like psychoanalysis. So those who are intellectually good will be better candidate for those psychotherapies. So and for other psychotherapeutic intervention, like if we are doing rehabilitation and other psychotherapeutic intervention for rehabilitation of cognitive function, then again this will be a tool for making assessment whether our therapy is working or not. Because if we are training, if we are trying to rehabilitate, recover some of the functions, then periodic assessment of the intellectual abilities should show some change or improvement. So these are broader clinical use. So we are studying intelligence test, but our focus will be more on how to use intelligence test, how to interpret the intelligence test scores to reach at these conclusions. Before I proceed to different methods, when we are using the intelligence test as a clinical tool, we should remember few things. I have mentioned four things to remember. First, we should be very clear that when we are using intelligence test as a diagnostic tool, the results must be interpreted in the given context, in the given clinical context, in the context of the whole test administration, because when you are administering test for clinical use, you should not only do the scoring, but you should also collect information how the client was behaving during the test performance. He may be not focusing on the blocks. Suppose you are giving him block design test, he may not be he may be throwing the blocks first and then collecting it, then he may be showing impulsive behavior or other. So the results must be interpreted in the wider context.
Hello,
Yes.
sir, have you changed the slide?
Yes.
So we can't see it. We are viewing. Yes, sir. Now it is visible.
Okay. Now you can see.
Yes, sir.
Okay. So I will not go in the slideshow mode. I think that is creating problem. So test results must be interpreted in context. I explained it. Similar test results depend on the examinee's cooperation and motivation. So, if a client is not cooperating or is not motivated to take the test, then the poor score may not be actual reflection of his or her poor intellectual ability. It will be a reflection of poor cooperation and poor motivation. So, we must, as a clinical psychologist, be very careful about these things. And as I said, when we will administer the test, we have to make note of all these things, how cooperative and how motivated the client was. And then we will take this in the first point, that is the broader context. Similarly, the test supposedly measuring the same ability may produce different scores. Suppose you are having two test scores and you assume that these two tests measure the same thing, but the client may have different score and there are different regions. I will not go in that detail. So we should take this point also into account. So if we are having several tests that reflect a particular ability, we should compare the score of all those tests and then we should infer something about the client. And finally, we have to remember that neither the individual subtest nor the group of subtests or the composite indices that are also referred as factor indexes, they do not measure unique cognitive process or abilities or construct. Even a single test may not be considered to measure a unique cognitive ability because it may involve some form of memory, some form of reasoning, some form of visual perception, because all we are showing is visual stimuli. We may also present auditory stimuli, then audition and auditory capability will also be there. So we should not interpret a subtest as an index of a single sole cognitive ability because that may involve a lot of cognitive process. So when I will come to the interpretation, I will give you a hint. There are many phones coming. Let me put it on flight mode. Similarly, we should consider some other things also. We should collect and integrate data from numerous sources, as I said earlier, that we should also observe the client. We should also take information from the informants about his or her daily activities because we can infer something about his or her clinical problem as well as intellectual ability based on that informations. So we should try to get information from as many sources as possible if we are using intelligence test as a diagnostic tool. Similarly, the conclusions must be supported or corroborated by different data sources. So based on one single test, we should not make any firm conclusion. If we are making conclusion, consider it as a hypothesis and then try to confirm that hypothesis from other evidences, from other data sources. And wherever possible, try to support conclusions with research that yes, there are researches which indicate that if this is the pattern of intellectual performance, then it is likely that this type of pathology or neuropsychological disorders may be there. And remember that interpretation should always be individualized. Why? Because the individualized context will differ from person to person. So we cannot provide a, an algorithm or a computerized mechanism where you put all these scores and it will give output in form of interpretations. Here clinical expertise is required and emphasize reliable and valid conclusions. So where we are firm that these conclusions are supported by research and supported by many data sources, we should emphasize only those conclusions in our clinical report, not those conclusions which may be refuted by some research or some other regions. So these are some important considerations when we are using intelligence test for diagnostic purpose or diagnostic assessment. Any question up till now?
Sir, could you please repeat first point?
Sorry,
Sir, could you please repeat the first point?
which point?
First one, test results may be interpreted in context.
You read the first point because I cannot. I have clustered the points in two categories.
Test results may be interpreted in context.
Test results must be interpreted in context.
Yes, sir.
Yeah, I said that whenever we get the test, it should not be processed. What should be done will be more clear when we will learn what should not be done. It should not be interpreted mechanically, just scoring, then converting it to some standardized score, and then comparing with the manual and saying that yes, this is average, this is below average, this is high average, like that. What we should do, that we should see the context of the client, his her clinical presentation, his her test behavior during the test administration. So as a clinical psychologist, and whenever you will see a form for clinical purpose, you will find that there will be a blank for putting remarks on each subtest. So we, I will show some other points also. We should take their motivation and cooperation level into account and other contextual factors, because those contextual factors are likely to influence the test score. Suppose you just entered in my room and without asking anything, I asked her, Shivangi, please sit and do this test. You will not perform the same way as when you will come. I will just orient you, and then when you will be at peace and calm, and then I will tell something about the test. If this happens, this context should be so. If you are having a low score in that situation, I will not interpret that you are having some intellectual impairment or deficiency. It I will attribute it to some other factors also. So is it clear?
Yes, sir. Thank you. Thank you so much.
Now can you see the slide change?
Yes, sir.
So the poor performance on intelligence test, that is low IQ, may not always be a reflection of some psychiatric disorders. It may be because of mental retardation also. So we must learn the definition and how to differentiate the two concepts, the mental or intellectual deficiency, this is the first one, and mental or intellectual deficit. The key word is lack, here you can say. So lack of intellectual resources defines intellectual deficiency, and loss of intellectual resources or capacity defines deficit. Just it may feel awkward to you, but it will be helpful to all of you to remember this distinction. Suppose I by birth born in a very poor family, and whenever you will search my pocket it will not have a single penny. So I am lacking money, I am lacking monetary resources, so I am poor. So that is lack. But suppose as a teacher I am having some salary and I am having some money, but suppose I lost the job, then I will be facing a deficit, monetary deficit, not monetary deficiency. So let us translate it in terms of intellectual deficiency and deficit. The first thing to remember is that intellectual deficiency means the individual is lacking the intellectual resources, and that lack occurs during the developmental period. During the developmental period, an individual has failed to acquire the intellectual capacity. That may be because of certain neurological regions, certain genetic regions. For example, trisomy 21. If an individual is having three chromosomes in 21st pair of the chromosomes, then that leads to a particular condition popularly known as mongoloid, but it is called Down syndrome, and that leads to a particular type of mental retardation because that genetic deficiency impairs the neuronal growth of the brain, and therefore the individual fails to acquire the mental or intellectual resources and capacity during his development. And therefore that condition, so mental retardation is an example of intellectual deficiency because the individual is lacking intellectual resources, he or she failed to develop intelligence. It may also refer to impaired intellectual development. Intellectual development was taking place, but the development was not at the same pace as it occurs in the normal individual. So this lack of intellectual resource or impaired intellectual development will reflect mental deficiency. On the other hand, if we are having some information that the individual was earlier having average intellectual capacity, but now he is not showing average intellectual capacity, he is scoring below average, then this is the case of loss of intellectual capacity. It means the intellectual capacity was earlier with him but has lost it due to certain reasons. Those reasons may include brain damage, those reasons may include development of certain psychopathology and many other reasons. But that will be a case of intellectual deficit. So deficit represents that something was there, intellectual capacity was there, but it has been impaired, it has been lost. Deficit also implies that intellectual resources are there, but the individual is unable to use it. For example, in case of learning disabled child, they are having average intelligence level. For example, ADHD child, he or she may have average intelligence level, but his scholastic achievement may be lower. So the deficit no, this is not good example. Deficit also implies that intellectual resources are there, but individual is unable to use uh, the better example will be that you are having, but because of say test anxiety, you could not perform the way you could. Similarly, because of chronic anxiety or neurosis, you are not. So it does not mean that development of neurosis results in permanent loss of intellectual resources. Intellectual resources are there, but because of our neurotic, anxious tendency, we are not able to perform on intelligence test and therefore we are scoring low. This is correct example. Apologies for the incorrect one. Is it clear?
Yes, sir. And sir, sorry to interrupt, but we have our class at 2 for psychology of adolescence.
Please be loud because my AC is making lot of noise. I cannot hear. Let me put off the AC. Yes, repeat.
Sir, some of us have since class at 2 right now.
At 2:05.
At 2 o'clock right now we have.
Okay, so just wait for a couple of minutes and I am closing this discussion. So,
Okay, sir.
intellect because it will be difficult. So, I will request only a couple of minutes and the teacher will allow you, I think. So, this is the difference between intellectual deficiency and intellectual deficit. But for diagnostic use, suppose two persons are having same IQ 70. How would you differentiate who is having intellectual deficiency, who is mentally retarded, and who is having intellectual deficit because he is having, say, schizophrenia, and therefore his score is 70? Thus, the diagnostic use of intelligence tests require a procedure or technique to differentiate intellectual deficiency from intellectual deficit. In the next class, I will teach you that. So, the basic assumption in the diagnostic use of intelligence tests is that certain personality traits, including pathological traits, can influence IQ. This is the basic assumption. If this assumption is not holding true, then the intelligence score will not change. And thus, these factors can change the subtest score profile. And also remember that the influence of psychopathology will not be global, but it will be limited to a certain specific cognitive domains. So, neurosis, say for example, or say schizophrenia may, for example, impair those subtest performance that involves social information because they are socially withdrawn. But where the social information is not there, they may perform equally good as normal average IQ individual. So the last slide, just to make this point clear. So these are the two cases, and if you will sum, I have just created based on my mm, own guess that these are four subtests of any intelligence. So you can say this is vocabulary, this is information, this is picture completion. You can give any name. So I am making this distinction without use of any test like Stanford, Binet or Wessler. There are four subtests and there are three circles. This is, if one is coming below, then it is below average. This range is average and this is above average range. Now, the average, if you will sum all the four subtest score, the four subtest score will result in equal IQ in both the conditions. But one is case of intellectual deficiency and one is case of intellectual deficit. Can you tell which one? The left or the right is intellectual deficiency?
Left one.
Why?
Because it is consistent throughout, and since the resources lack, so the person should not be performing well in all conditions.
Yeah. So there is no scatter. You can see that the all the four subtest scores are near this line and it is close to this. However, in this condition, because of certain pathology, these two subtest performance, subtest 2 and subtest 1, have been lowered. But the individual is having good score, above average score in test 3 and around average score in test 4. So this is a scattered pattern. So the profile will be consistently low across all the subtests, and if you will compare the standard deviation of these subtest score, the standard deviation will be low. But when you will compute the standard deviation in this condition, it will be high. So this provides that scattered performance means high performance on subtest, average performance on other, and low performance on some other test may indicate intellectual deficit. That is deficit because of certain psychopathology, brain damage or dysfunction. But if it is lack of intellectual resources, if the person is mentally challenged, having mental retardation, in the case of intellectual deficiency, then she will consistently show low score on all the subtests. Thank you very much. So I am ending this class. You can now leave the class and join.